Okay, so in this video we're going to talk about the chambers of the heart, starting on the right side, and we'll talk about the relevant anatomy of each. But just before we get started, I just want to quickly orient the apex and base of the heart. So we know the apex of the heart points left here, and it'll sit in that cardiac notch of that left lung. And the base of the heart is this big flat portion, which will sit on the diaphragm. And now we're going to dive into the right atrium, which I'm just going to flip open here. And the first thing we should notice is the muscular lining. I'll actually bring that a bit closer so it's easier to see. And you can see the pectinate muscle here, which lines the atrium. Okay. And that muscular layer helps push blood into the ventricle. But before that happens, blood needs to still enter the atrium. And that's going to be from the superior vena cava here and the inferior vena cava down here. Okay. Now there also is another vessel which will drain into here. And this is going to be from the coronary sinus, which is right here. So after the heart has been supplied with blood, there's waste blood, and that's going to drain right back into this right atrium through that coronary sinus. And then lastly, we have the fossa ovalis. So this, in me and you, hopefully is nicely fused back up like it is in this model. But when we were fetusi, I don't really know the plural of that, this was unfused. It was nice and open, and it allowed travel from blood on this right side to the left side. And I encourage you to pause this video just for a second and ask yourself, why do you think that's necessary for fetus flow and not for adult flow? And now, assuming you've done that, in a fetus, we don't have working lungs, or at least we're not breathing in air and harvesting oxygen as we are as adults. So we want to bypass that pulmonary system, because remembering the right side of the heart here that we're in will pump to the pulmonary system, and the left will be systemic. Okay? And importantly, this is just located in the interatrial septum, so which is just a fancy word, but I like to think of it as like a fence between the atrium. And there'll be a ventricular one later we'll get into. Okay, so now pretending we're a little blood drop and we just got into the right atrium through any of those routes, we now want to pass into the right ventricle. But before we do that, we need to bypass a valve. And it's shown pretty crudely in this model, but normally there's 3 cusps or leaflets, which are here, here, and here. And they make up the tricuspid valve, which makes sense if you break it up. Tri meaning 3, and then the cusps. And now each cusp is tethered by a chordae tendineae, which is these rod-shaped or string-shaped connections. And the chordae tendineae are controlled by the papillary muscles, which are these kind of outcroppings of muscles here, which will control the state of the valve, so if it's to open or close. And then also the lining of the ventricle is made up of trabeculae caudinae, which are these columnar shaped muscle groups. Not to be confused with the walls of the ventricle, which is made up of endocardium, myocardium, and epicardium. And remembering when I just was talking about the connection between the 2 atrium, or the separation between the 2 atrium, we also have the separation between the 2 ventricles here, which is made up of the interventricular septum. Okay. Also, this model actually shows it pretty nicely. The thickness of each ventricle is different, right? The left ventricle is much larger comparatively to its other side, because here we're pumping to the entirety of the body, or the systemic circulation, whereas the right side's only really concerned with pumping to the lungs, so you need a lot less force comparatively. Okay, so the blood drops now in the right ventricle. We go out into the pulmonary system, and I'm going to skip that. We'll talk about it in a different video, but pretending now we're coming right back in to the right ventricle, or sorry, right atrium by the pulmonary veins, which are shown here and here and here. So we still have the pectinate muscle. We have the other side of the fossa ovalis in that interatrial septum. And we're going to pass again into the, this time, left ventricle, but it's going to be a bit different. Hopefully this refocuses. There we go. You might be able to notice there's only 2 cusps this time. So you guessed it, this is called the bicuspid valve. Still have the chordae tendineae, still have the papillary muscles. That anatomy doesn't change. The other difference is now when the blood's ejected from the left ventricle, it'll pass through this aortic valve and then up, of course, into the aorta, and then the rest is systemic circulation. And that's all you need to know for the heart chambers.